Hi and welcome back to another video of Medic Notes. This video will be on bipolar disorder. Bipolar disorder, previously named as manic depression, is a mental health condition that causes extreme mood swings. And these mood swings include emotional highs, which are mania or hypomania, and emotional lows, which is depression. So when you become depressed, you may feel sad or hopeless, lose interest and pleasure in your previous hobbies. And when your mood shifts to mania or hypomania, you may feel euphoric, full of energy, or irritable. So there are two sides of the mood swings in bipolar disorder. To diagnose someone having bipolar disorder, we can refer to the DSM5 diagnostic criteria. So the first criteria is there is a distinct period of abnormal or persistently elevated expansive or irritable mood, which lasts for at least 1 week. And during the period of mood disturbance, we will need 3 or more of the following symptoms, which include an inflated self-esteem or feeling of grandiosity, decreased need for sleep, for example, one feels rested after only 3 hours of sleep, more talkative than usual, which can be noted by the family members, having flight of ideas or racing thoughts, a lot of thoughts racing inside the mind, distractibility, where their attention is very easily drawn by something unimportant or irrelevant external stimuli, an increase in goal-directed activity, either socially, at work or at school, or even sexually, and also an excessive involvement in activities that have high potential for painful consequences, such as engaging in spending sprees, sexual indiscretion, or foolish business investments. So these are the criteria that suggest manic episode, which is seen in bipolar disorder. So there are two types of bipolar disorder, which are bipolar 1 and bipolar 2. For bipolar 1 disorder, the individual must have at least one manic episode to fulfill the diagnostic criteria of bipolar 1 disorder. Whereas bipolar 2 disorder, they must be a past or current hypomanic episode, in addition to a past or current major depressive episode. Hypomanic means that it is a less severe of manic episode. Just now, manic episode, we need at least 3 of the symptoms for at least 1 week. Hypomanic episode, the duration is only for at least 4 days. It will be named as hypomania. So the difference between bipolar 1 and 2, the bipolar 2, there is a current or history of major depressive episode. So hypomania plus depression. To investigate for this bipolar disorder, we can do full blood count and ESR, liver function test, renal function test, thyroid function test, fasting lipids, and also the body weight measurement. This is because later on the treatments such as mood stabilizers are often associated with metabolic syndrome. So we have to measure the BMI as a baseline. Other investigations include VDRL, urine drug screen to rule out substance abuse, pregnancy tests for those female patients who may be pregnant, CT or MRI of the brain to rule out space-occupying lesion, any brain infarction or intracranial hemorrhage, ECG to rule out prolonged QTC before giving medications, and also EEG to rule out epilepsy. This is the scale instrument that is used in mania episodes, which is the Young Mania Rating Scale. So the picture shows the scale. So this YMRS is an 11-item questionnaire which will help the clinicians to measure the severity of the manic episodes and can be used in children and adolescents between the age of 5 and 17 and can also be used in adults. So if you see in this picture here, it includes questions covering the elevated mood, the sexual interest, how's their sleep, any irritability, their speech, and so on. For management of bipolar disorder, the acute management of a manic episode, hospitalization may be necessary in those patients who present with severe manic symptoms or with serious risks such as violence or sexual indiscretions. And some manic patients who refuse treatment may need to be admitted into ward under the Mental Disorder and Treatment Act. Pharmacological treatment includes antipsychotics, can be used for the treatment of acute mania, such as haloperidol, aripiprazole, olanzapine, quetiapine, and risperidone. Mood stabilizers, such as sodium valproate or carbamazepine monotherapy, can be used to treat acute mania. Combination pharmacotherapy, where antipsychotic and mood stabilizers are used together for those who show inadequate response to monotherapy. And for agitation in mania, the acute treatment that can be given are haloperidol, olanzapine, clonazepam, or lorazepam. Whereas the acute management for bipolar depression, for those patients with mild depressive symptoms, we can review the patients in 1 to 2 weeks without starting an antidepressant. If the symptoms become moderate or severe, we can consider adding antidepressant to the mood stabilizer. So the pharmacological treatment, antidepressants such as SSRI like fluoxetine is the first line. And mood stabilizers, lithium, can be used in the treatment of bipolar depression, and also antipsychotics such as quetiapine monotherapy, olanzapine, or olanzapine and fluoxetine combination can be used in the treatment of bipolar depression. For non-pharmacological therapy, there is the psychotherapy, which is the cognitive behavioral therapy. It's recommended for patients who have bipolar depression. That's all for this video. Thank you.